thyroid health is, and for none other than we have Zamrud, who is the head of dietitian at the Glen Eagles Hospital, as well as the Indian Dietetic Association. She's a president, and she has published so many papers. So we are very happy to have her as moderating. Rohit is joined in from UK. It's very, very cold there, almost 2 to 5 degrees centigrade. And he must have really traveled in really cold situation to come to deliver this lecture. Thank you, Rohit, so much. And I think I'll just leave it to you all, leave the platform to you all to take it further. Thank you so much.
Thank you.
Yes,
So,
Zamrud, start.
Zamrud,
Yes, thank you, Rohit, for accepting this talk. And of course, you've been giving this series, you've done the full series, so the audience is knowing you very well. So they are eager to hear you. Can I have a series slide of Mr. Rohit? We have that?
Actually, Rohit's CV slide has been played so many times in the series.
Okay.
Everyone
So
knows who's Robert
okay. So then can I request Rohit to
actually
start with?
manufactured and
yeah,
made and everything.
I'll
So
I
now
will
Rohit
start.
needs no introduction.
I know,
Thank you.
that's it.
Thanks. Yeah.
Yeah.
Yes.
So
Yeah,
we can
Thank you
just
very much.
plunge in right away in thyroid health. Rohit,
please,
over to you.
please.
Okay, so
Thank
the
you. Yeah.
topic, as we all know, is very interesting, very upcoming, and very concerning at the same time. And one of my favorite topics to talk about. I have a short presentation, 20 slides, but the presentation and the information on the slides is based on two things. One is latest research, scientific research. What does the scientific world say? There are no assumptions here. Everything that would be said would be backed by solid scientific evidence. And two is my own experience, from around the world, and what I've seen. So basically, thyroid gland, this is going into a bit of basics, but let's just freshen up. The thyroid gland hormones affect virtually every organ and every system in the body. And the T3 is the active hormone that increases BMR, promotes macronutrient breakdown, thermogenesis, and muscle synthesis, and supports growth and CNS development also in kids. It also influences skin moisture barrier by influencing the skin barrier formation, as well as gut mobility and digestion. So you can see all those different areas I've mentioned there. Calcitonin is another hormone produced by the thyroid gland, which has a distinct function from T3 and T4. It lowers the blood calcium by inhibiting its reabsorption in the kidneys and intestines, and promotes bone calcium deposition by regulating osteoclast and osteoblast activity. In short, if this hormone is not regulated properly, you would start leaching of calcium out of your bone reserves, and you will have, you will start losing the bone mass or bone mineral density, which happens in old age, it happens in menopause, it happens during breastfeeding, etc., different phases of life. So hypothyroidism and hyperthyroidism have a higher incidence in iodine deficient areas like India or South America. In India, iodine is actually a replete. India can be classed as a replete place for iodine. People take enough salt, etc. And there is, iodine in seaweed, in salt, but still it is considered as one of the areas of deficiency. The most common cause of hypothyroidism is Hashimoto's, whereas of hyperthyroidism is Graves' disease, as we all know. Some of the factors that contribute to the differences in thyroid disease prevalence include excessive iodine supplementation, endocrine disruptors, and of course, genetic disruptions. Females are disproportionately affected by thyroid disorders with regards to autoimmune diseases. For instance, female to male, the Hashimoto's predominance is 10 to 1, while Grave disease predominance is 5 to 1. So for every one male patient, you will have five females. And in terms of Hashimoto's, for every one male patient, you may have 10 females. So the ratio is actually very, very disproportionate. There's a very high disparity. And you can see that in both hyper and hypothyroidism, the prevalence. The left side of my slide shows you hypothyroidism, and the right hand slide shows prevalence of hyperthyroidism. Now, the common things here are that countries are same. The regions that are affected by thyroid disorders are similar, and you can see India in both the regions. Stress and obesity can also contribute to hypothyroidism. In chronic stress, increased cortisol and CRH suppresses TSH release. Cortisol can also reduce the, the deiodinase activity, decreasing the conversion of T4 to the active T3 hormone, while also increasing reverse T3 levels, which is the inactive form of T3, the RT3 level. In individuals with obesity, the pro inflammatory cytokines can inhibit the sodium iodine supporter, reducing iodine availability for thyroid hormone production. These cytokines also reduce thyroid hormone receptor expression and deiodinase activity, resulting in thyroid hormone resistance. Additionally, the pro inflammatory status can promote autoimmunity by increasing the reactivity of immune cells and contributing to thyroid cell damage, which exposes their proteins to the immune system. So again, immune health also gets affected by thyroid dysfunctioning. Apart from stimulating energy release, vital for growth, thyroid hormones affect it also indirectly. There is a close relationship between the hypothalamus pituitary thyroid axis and the growth hormone IGF-1 axis, where thyroid hormones stimulate the release of growth hormone from the pituitary gland, while the growth hormone stimulates the conversion of T4 to T3 in the periphery. So, in hypothyroidism, this relationship is undermined, resulting in a simultaneous decrease in the growth hormone release and a decrease in the T3 activation as well, which you can see in the figure. So long-term low carbohydrate diets may be harmful to thyroid function as they decrease the T3 levels by decreasing the insulin-stimulated expression of deiodinases, which are necessary for T3 activation. So, for example, I've given one example of ketogenic diets, which are very, very low in carbohydrates and slightly higher in proteins, but very high in fat. So, these ketogenic diets also increase stress hormone levels to enhance glucogenesis and lipolysis, which indirectly inhibits thyroid hormone release and activation in the periphery. Actually, the diets that are higher in carbohydrates dampen stress induced cortisol levels, thus being more beneficial to the thyroid function. I'm not saying that your diet should have very high levels of carbohydrates, no, but very low levels of carbohydrates below what you need for your energy function and functioning of enzymes and hormones in the body can be very detrimental. And hence, diets that are very low in carbohydrates are okay for short term, but definitely not good for long term. If you could do the BMI management, body fat level management without those low carb diets, it's even better. It can be done with a low carb diet, but with a balanced diet, which is divided into several meals. What the previous slide said was that doing that with the help of a particular diet that is very low in carbohydrate may not help your thyroid function. Iodine is essential for thyroid hormone synthesis, as you know, as it is incorporated into the thyroglobulin, forming the basis for T3 and T4 production. Selenium is a cofactor for glutathione peroxidase. Helps prevents oxidative stress, excessive levels of which can decrease the activity of hormone synthesizing enzymes and lead to damage of the thyroid gland. Being a cofactor of deiodinases, selenium is also involved in T3 activation. Now, iron is a cofactor for thyroperoxidase, is crucial for thyroid hormone production, with deficiencies linked to subclinical hypothyroidism. So again, iron is very important. And zinc also supports thyroperoxidase activity and is necessary for thyroid hormone receptor expressions in tissues. Vitamin E, as a potent antioxidant, has a protective role against oxidative damage to the gland and its cells, to the oxidative damage of thyroid gland. Vitamin D, again, a very omnipresent vitamin, very important vitamin. Its deficiency may increase the risk of autoimmune diseases. Vitamin D inhibits the pro inflammatory cytokine secretion from dendritic cells. This shifts the Th1 cells to Th2 and reduces the activity of Th17 cells, decreasing the cytokine mediated thyroid destructions. Vitamin D reduces MHC2 expressions in thyrocytes, preventing the presentation of autoantigens to T cells. Vitamin D inhibits plasma cells differentiation, thus reducing the autoantibody production. Lastly, it also promotes a differentiation of regulatory T cells, which is the key in maintaining immune tolerance to self antigens. So, in all different ways, vitamin D can help thyroid function. The symptoms of under or overactive thyroid stem from aberrant T3 levels, which slowed down metabolism and organ function, or increased metabolism or organ function, respectively. In hypothyroidism, the symptoms include uh, cold intolerance, weight gain, slow heart rate, constipation, irregular periods, and subfertility, fatigue, insomnia, dry skin, hair loss, etc. In hyperthyroidism, these include again weight loss, heat intolerance, anxiety, heart palpitations, diarrhea, fatigue, insomnia, bulging of eyes, and difficulty in concentration. So the symptoms could be different in both hypo and hyperthyroidism. Untreated hypothyroidism can significantly raise the risk of cardiovascular disease. As thyroid function declines, your LDL cholesterol levels rise because thyroid hormones normally stimulate the LDL receptor activity, which clears LDL from the blood. Additionally, activation of lipoprotein lipase, which breaks down lipoproteins, is diminished, causing higher serum triglycerides and HDL. Furthermore, autoimmune induced chronic inflammation leads to endothelial dysfunction by reducing nitric oxide production and increasing vascular resistance. Untreated thyroidism increases the risk of osteoporosis also, and it can also cause congestive heart failure. Elevated T3 levels accelerate the bone remodeling cycle, shortening the bone formation phase. Concurrently, low TSH levels fail to inhibit osteoclastic activity, resulting in a higher rate of bone reabsorption and bone loss. With regards to the heart complications, increased T3 levels elevate heart rate, enhance left ventricular contractility, and increase blood volume by stimulating the RAS system, RAS system. Over time, these changes can culminate in cardiac hypertrophy, progressive reduction in cardiac output, and untimely congestive heart failure. So now I'll discuss the 6 factors that need to be considered in the management of thyroid health. Insufficient sleep has a negative effect on thyroid function by increasing the cortisol levels and pro-inflammatory cytokines, which collectively inhibit hormone secretion and conversion. Effective strategies for sleep improvement include relaxing techniques, sleeping, having a sleeping routine, avoiding stimulants like caffeine, and electronics before bed, avoiding the screen time. Also, regular exercise, creating a restful environment, etc., could also help with sleep. As discussed previously, chronic stress may also negatively impact thyroid functions, thus necessitating stress management techniques such as relaxation, breathing techniques, or self-care for thyroid health improvement becomes very, very important. But the sleep and relaxation or anti-stress things become a part of your lifestyle. They are not really a part of therapy. They could be a part of therapy, but it's more related to your lifestyle. It's not something that you take, it's something that you change about yourself. Gut bacteria have been implicated in thyroid disease pathology via gut thyroid axis. Beneficial bacteria promote immune tolerance and an anti inflammatory state by upregulating the regulation of T cells, thus lowering autoimmune disease risk and complication. Gut bacteria increases intestinal integrity, thus lowering thyroid damage and immune activation caused by systemic inflammation. Gut bacteria may also impact the absorption of micronutrients necessary for thyroid hormone synthesis, while also affecting the activity of proteins involved in thyroid hormone metabolism. The airports were disconnected from the phone? No, they are fine.
You want me to check the setting once, if you don't mind?
Yeah, maybe. There's just one technical glitch. 1 second. The our IT is going to check the sound system.
Oh, we are hearing you fine.
You're hearing me fine?
Yes,
Yeah,
yes.
you can hear. There's
It's
no
fine.
problem.
It's perfectly fine.
Yeah.
Is it any better now?
It's good. It's good. You can just go on.
You
It's
can
gone.
go
Yeah,
ahead.
it's
Yeah.
gone.
Yeah.
Yeah, thank you. Right. So, moving on. Uh, Supplementation and why the supplementation, I call it targeted supplementation. It's very, very important to look into those micronutrients and amino acids, botanicals that are important and that can actually affect thyroid function. Now there are hundreds of products in the market. What we need to look at, what are those micronutrients, which micronutrients or polyphenols or antioxidants or anti-inflammatories of natural origin that are really going to improve your thyroid function, is what we are going to look at. So L-tyrosine, being a precursor for thyroglobulin, could increase thyroid hormone production in hypothyroid patients. So this amino acid is also a precursor for dopamine, as we all know. Therefore, it can alleviate depressive symptoms in thyroid disorders also, which is very common. It's a very common etiology. It's very commonly seen that these thyroid affected patients are also depressed, or they show signs of anxiety and depression. So L-tyrosine, as a precursor of dopamine, becomes a very important ingredient to be incorporated in micronutrient or supplementation therapy. Vitamin D's immunoregulatory properties, as we saw in the previous slides, can decrease autoantibodies in autoimmune thyroid disease while increasing thyroid hormone levels. So it becomes very important again. Resveratrol and curcumin, as you can see here, have strong antioxidant and anti-inflammatory property, which can decrease the oxidative stress and inflammation associated with damage to the thyroid. Ashwagandha, by reducing cortisol levels and improving sleep quality, may increase T3 and T4 levels. Its phytochemicals also have strong anti inflammatory properties. And apart from zinc's normal role in thyroid function, zinc is also a cofactor for antioxidant enzymes, thus targeting antioxidant or oxidative stress or ROS reactive oxygen species. Magnesium is involved in thyroid hormone activation and the activity of thyroid hormone receptors while via phosphorylation reactions. Magnesium supplementation can also improve sleep and reduce cortisol levels, indirectly affecting thyroid health. Omega 3 fatty acids, any polyunsaturated long chain fatty acids such as omega 3, can serve as substrates for inflammatory resolving molecules, including resolvins. Thus, it may also help resolving inflammation seen in autoimmune thyroid diseases. Low to moderate intensity aerobic and resistance exercise can improve thyroid functions and dyslipidemia in patients with hypothyroidism. These exercise regimes can also improve depressive symptoms and sleep quality, other complications that usually persist in population group despite drug treatment. So they could be good treatment, patient could be responding, but the response would be better by incorporating these lifestyle changes. Patients with hypothyroidism have low physical activity tolerance due to impaired energy metabolism and the muscle weakness, etc. And hence, starting with low impact exercises like walking or gardening might be of substantial use, while also helping in the management of the hypothyroidism associated complications like mental health, as we were talking just before the webinar started. So all these factors have to be put in together. It's the lifestyle, it's the sleep, it's the exercise, it's the moving your body, it's the right kind of food, it's right kind of calories, not being on very strict diets, but being on diets that are healthily in a healthy way supporting your lifestyle. And of course the micronutrient supplementations that we talked about. It's not just the iodine, but it's the cofactors like zinc, iron, magnesium, selenium. Those can be very useful, and also the B vitamins, because they are involved in the metabolism use of the carbohydrates that you take in. So the take home message is very simple. Thyroid diseases have a very complex etiology, as we know, with many lifestyle factors having both negative and positive effects on the overall health of the thyroid. In turn, these influence virtually every organ in the body, and hence why it also becomes very important to treat thyroid dysfunctioning. Micronutrients play a very important role, particularly iodine, selenium, zinc, iron, vitamins like B vitamins, vitamin D, and hence it is important to consider supplementation in thyroid related dysfunctioning patients. A holistic approach overall to improve thyroid health should include all this and stress management, which also include good sleep, etc., and of course managing the health of your gut with friendly bacteria, pre and probiotic, etc., is also recommended. Exercise regimes and low impact physical activity could be encouraged in patients with hypothyroidism to improve disease complications, especially improving mental health. And lastly, I have given a list of references. There are 55 papers which we have read, and this the 1917 slides that you saw before the references are all summing up of these 55 studies that we consider. They're all very recent references from peer-reviewed scientific journals, and I'm sure those will be very helpful to you. Thank you.
Wow, Rohit, it was just revising and re-revising, and it was so beautifully put up, short, sweet, crisp. And I can
Thank you.
see the way the questions have popped up in my chat box. That indicates that how people have understood and they want to have little more clarity on some of the points. So I'll start with the chat box
Please,
question first. Yeah.
please. Yes, yes,
So
please.
the first question reads as is there any correlation with recurrent skin infections and thyroid, especially that of hair follicular infections?
Hair follicle, there is a deep connection of hair follicular infections with thyroid dysfunctioning because, as I said in my very first slide, skin
Mm.
moisture barrier and the hormones that control the oil sebum production in the
Mm.
skin, which effectively forms the skin barrier, is controlled by thyroid hormones. So, if the thyroid is dysfunctional, you will have a dysfunctionality to some extent of that sebum producing, activity or the process, which actually is at highest in the hair follicle. So it depends upon what you have seen in your patients, but yes, there is a direct correlation, and it is not just recurrent; it's actually an ongoing thing. If the thyroid hormones, if there is an imbalance in thyroid hormones and dysfunctionality, your skin barrier will have dysfunctionality. Now, this manifests in two different ways. It can manifest, and a dermatologist would be better to explain this, but I can explain you what I understand. It can manifest in two different ways. It can manifest as dry skin, extreme low production of sebum, but it can also go to the other end of the spectrum, which is extreme high production of sebum. And in both ways, it is bad. The extreme low production of sebum, which can be affected by non-functional T3, it can be caused can cause extreme dryness, and in worse situations it can trigger skin conditions like eczema even. But in the extreme, at the other end of the spectrum, is high production of sebum, which can also happen in thyroid hormone imbalance, that produces extremely high level of oil globules in your hair follicles at the bottom of your hair shaft, and that can produce skin conditions such as severe acne, which are difficult to treat, etc., whilst you're going through the treatment as well. As because all sorts of treatment approaches include hormone functioning and hormone effects, these things are very difficult to control. And a few ingredients in nature could help control that. And one of the best is zinc. So generally, these patients would be very deficient in zinc, and if you could supplement about 20 to 30 milligrams of zinc on top of their non-vegetarian diet. Vegetarian diet has comparatively less zinc, but on top of a normal non-vegetarian diet, if you can give about 20, 25, 30 mg of zinc as supplementation, that would be very useful.
I think the answer is very clear. What you need to do is not only about why it is so and what is the remedy for it. So you did discuss about vitamin D, and I can see the next question is on vitamin D. Can we use 60K per week prescription also for Hashimoto thyroiditis patients? Is the question that the person is trying to ask for vitamin D.
So the answer is yes, you can use 60 K international units IU of vitamin D, but I would recommend that to be divided into 6 doses. So I would like to see a patient taking 8, 9,000 per day,
Mm.
7 times a week maximum, than
Mm.
having one dose of 60,000. The reason behind that is vitamin D, whichever source you get it from, it is a fat. Whatever source you buy, whichever
Mm.
brand of product you buy, it is a fat, and it comes from lanolin, which is basically obtained from sheep wool. And that lanolin, there is a cycle how that lanolin gets converted into the actual cholecalciferol, which then gets utilized by the cells, right? It is a fat, and any kind of drug or supplement that is fat bound is better taken down into broken parts because of the way it is metabolized in the body. 60K may not be fully metabolized, and it would be anything that is not metabolized will be held back by the fat cells in the fat tissue, adipose tissue, and that will trigger some other reactions. And hence why I think anything that is fat bound or fat soluble should be better taken in divided doses. Hence, the 60K is not a problem if you take it as 8 or 9K 7 times a week.
But is this available, Rohit Ram?
Yes, yes, it is available. You can also, I mean, it is available because I work for vitamin brand Vitabiotics, and I don't want to be seem to be just trying to sell the product, but I can vouch for the quality of Vitabiotics products. They're the best products in available in the market. Most of Vitabiotics products are now available in India through our sister company, Mayor Organics in India, and
Mm.
we have excellent vitamin D range of products. We have from small dosage of 1,000 IU to large doses, also 3,000, 4,000, 7,000, 8,000, I think they have. So you can adjust your doses. If you buy a tablet that gives you 400 IU, 4,000 IU, sorry, you can take two a day, 2 tablets a day. That will give you 7, 8,000 IU per day. But if you buy a product that gives you 8,000 IU, then you just need one tablet a day. These are very small tablets, very convenient to take. They are fat soluble. The only thing you need to be careful about is take it on a full stomach. If you take it on a full stomach, there is enough gastric secretion to absorb the fat soluble vitamin right in the gut. So I think yes, in short, 60K absolutely fine, but 60K in one dose not good. 60K in divided 7 or 8 or 9 doses is perfect.
So the next question is, are there any clinical examination criteria for spotting iodine deficiency?
Oh, there are many iodine testing done. Depends upon the costs. I mean, generally, I wouldn't call iodine testing as a pathological test. They are generally done in any kind of clinic, hospitals, and you get the blood iodine levels. If you check, most of the population will be iodine deficient. It's like vitamin D that we don't even know it is deficient. And what is more important is what is causing this deficiency. I can tell you that if you, especially women, 9 out of 10 women are iodine deficient. I can guarantee even dietitians themselves are iodine deficient. And the reason is that we have gone too far into replacing normal foods by healthy foods and whatever we call it, low fat food and all of that. When you replace foods, and when you consume overly processed foods, iodine is one of those rare elements, the minerals that gets taken out. For example, a lot of people talk about lactose intolerance, how bad milk is, and all of that stuff. And they've stopped drinking normal milk. They go on almond milk and oat milk and whatever, anything white liquid. It's not milk actually. It's just a white liquid that comes out of the grains. Oat milk is not milk. Composition is completely different from milk. It doesn't have that fat protein ratio that normal milk has. It's just a white drink with carbs. But they take that, and when you do that, you take out normal components of food. So when you take less seafood, when you consume less milk, that those are the sources of iodine. And if you're on any kind of restrictive diets, which control your lactose, this and that, you will be iodine deficient. 9 out of 10 women are iodine deficient today, and it is not only affecting them; it's affecting the next generation also, because we see women, young women in their 20s are iodine deficient. Then they go into pregnancy with iron deficiency. Then the baby is born with iron deficiency, and the mother's iodine level is directly proportional to the baby's IQ when the child grows up. So you're actually damaging the brain, the cognitive function of the unborn child by being iodine deficient. So yes, there are plenty of tests that are clinically available. Every country has its different regulations and different kinds of testing procedures. Here we do by the NHS iodine testing, but there is a big deficiency around the world, even in countries that don't show in that heat map that I showed you in the beginning.
Yeah.
UK is not as bad, but even for UK, it's a big problem. There's a recommendation of iodine in all foods, especially for to maintain the fertility of women.
So our next question is on what is the role of myoinositol and berberine in autoimmune thyroid condition?
Not much. It is, I mean, there is a role, but it's not that big. Myoinositol is just another, empirical formula. It's different. It's a myo form of the inositol. It's generally very active if you take it in the form of hexaphosphate, phosphate bound inositol. And same with berberine. They are strong antioxidants. They're very good agents that promote and control cell growth, etc. They are more useful in uncontrollable cell growth problems such as cancerous tissue than in thyroid dysfunctioning. But as antioxidants and anti-inflammatory, they can be used as an adjuvant therapy. But from the clinical data we have and clinical trials we have, I would say if I was to rate them on a scale of 1 to 10, it would be 6 or 7. It's not a very strong evidence against that. What has very strong evidence on natural treatment is iodine combined with selenium, iron, magnesium, and zinc.
So actually the next question was what was the role of selenium, and if you want to put more highlights onto that.
Yeah, selenium works on selenoproteins, very very important constituents in the general GI management and hormonal management of the body. So absolutely, very very important ingredient. Selenium is also a cofactor in the absorption of other minerals. So, for example, selenium works with zinc to promote the antioxidant activity. Selenium can be a very strong anti-inflammatory if given alongside magnesium. So selenium's role, zinc and selenium plays such a big role as a strong antioxidant together. They also modulate your immune system. They also control cytokine storm. They also prevent pro-inflammatory cytokines from affecting your cells. So they affect T3 and T4 cell functions as well. So they are selenium is one of the omnipresent antioxidant mineral that is available in every cell. The selenoproteins and selenoreceptors are available in most cells of the body, and hence they can selenium is useful in its antioxidant activity throughout all cells of the body. As thyroid affects other organs also, protecting the cells of the thyroid through the right level of selenium becomes very important.
So the next question that they're trying to ask is how does one interpret 3334 and along with TSH levels?
How does people?
How to interpret T3, T4 levels along with TSH?
Yeah, so TSH level will determine the T3. It's the other way around. It's not the T3 and T4 levels that show the TSH. TSH level is related to T3 and T4. How healthy levels of TSH you have will show in your T3 and T4. And the best way to control that or to monitor and to keep them in check is to make sure that your micronutrient supply is right. Often it's seen that TSH levels falls by 2 or 3 different things. One is a very bad lifestyle, and it's particularly seen in women. The TSH levels will be off the charts if they have a bad lifestyle, which includes drinking and smoking. If a woman is smoking regularly, the TSH levels are off the charts all the time. That will also affect active 3C levels and T4 levels. If you're drinking, you can think that, oh, only 2 or 3 times of a glass of wine may not be as bad, but actually only 2 units of alcohol per week can, which is a glass of wine twice a week, can affect hormonal levels, can shoot up prolactin levels, and also cause decrease in the TSH levels. So, which will affect the T3 and T4. So it's very related to lifestyle and ROS, presence of reactive oxygen species in the body. So the best way to keep the TSH levels under control is having a steady, good lifestyle. Sleep is again a very important factor, but the most important thing is not exposing body to toxins, not exposing cells to toxins. And these toxins generally come from lifestyle, such as drinking and smoking.
True. So, there is a question here which says that low gluten and low casein diets are becoming very popular for autoimmune thyroid diseases. So, what is your view on these?
They are not becoming popular because they have science. They're becoming popular because nutritionists are going and talking about it on social media all the time. Honestly, I don't want to put anyone down, but there is very little connection of milk protein and autoimmune related thyroid problems. There is very, very low connection of that. What really connects autoimmune thyroid diseases is omega-3 fatty acids. If you have to pick a positive connection between chronic inflammation, autoimmune thyroid diseases, then they are all low in polyunsaturated fatty acids. Their ratio of omega-3 to omega-6 is very, very high. It should be 2 to 1, but it's 15 to 1, 20 to 1, 30 to 1 these days in population. So we are having very low omega-3 as compared to omega-6. That is where the problem is. But these things are, casein diet and low carb diet. It is just a fad created by these non-endorsed nutritionists. I would say carbohydrate is very important. That's why I put that slide about ketogenic diet. Actually, it was a bit off the track, but I thought I should mention that because as dietitians, you get asked questions by patients who come with Google knowledge. They read on Google and they come and tell you that, oh, I think I should take milk out of my diet and I should take lactose out of my diet. No, you shouldn't take milk out of your diet, and you shouldn't take lactose out of your diet, especially women, because the fat that comes from milk is extremely important because all female hormones are either fat derived or fat dependent, particularly for females. You cannot take fat out of your diet. You cannot take natural fat coming from milk out of your diet. Everybody is after skim milk, and you can manage calories with all the foods that you consume. If you want to lose fat, for example, most women or male also are after fat reduction, getting slimmer, looking better, and they compromise with micronutrient level because they drop their macronutrient levels to so low levels. Dropping casein is going to affect your sleep negatively. And I already showed a relationship between sleep and stress and thyroid hormones. So it's actually going to have a negative effect than a positive effect. So no, I wouldn't say. I said there's very low science in that. These ketogenic diets, 1 meal a day diets, they do not help. The best thing is do what is the basic, is eat smaller meals,
Yes.
control your calories, and have everything in moderation, and look after the mental health, look after the organ health, your brain health, pituitary gland health. And if the organs are healthy, you will look externally also fine. You will have a better health, internal and external. Just trying to reduce fat from under the skin and from your fat tissue is definitely not going to help. And if that's why I keep repeatedly telling people, monitor your body fat percentage, and the lower it is, the better it is. But do not go by what the BMI tells you, because the BMI is not the right measure of checking health.
Okay, and our next question is, can we reduce anti-TPO levels through lifestyle modifications?
Yes, you can to a great extent, and particularly as I said. See, there are three factors in lifestyle modification that would really help, and this is also scientifically shown, not only in thyroid patients but also in diabetics. And you can do that by improving your sleep. If you're sleeping for 4 or 5 hours, try to sleep for 8 hours. And reducing your stress levels, and doing any kind of exercise 150 minutes, uh, most preferably aerobic exercise where you are breathing more. You can do it for 150 minutes a week, which is 5 times a week, 30 minutes a day. These two things can show you results straight away, even before you start supplementing and change making other big changes.
Okay. Now you have a comment, Rohit, for you by Dr. Rita Patel. A very good session. Okay. So she's there in
Thank you,
the.
Dr. Patil.
Okay. Now, what is the role of magnesium and zinc, and what supplements do you suggest?
So magnesium is involved in, related to thyroid, it is related in hormone activation and the activity of thyroid hormone receptors via phosphorylation reactions. Phosphorylations need molecules of magnesium at cellular level. So magnesium supplementation would do that, will improve the activity of the thyroid hormone receptors via active phosphorylation. This is what we learn in Krebs cycle. Magnesium also helps improve sleep by increasing cortisol levels, particularly for older patients who have very low level of melatonin. Because as you start aging, one of the hormones that start lowering naturally, or also called neurotransmitter change, is body is not making enough melatonin. When the body doesn't make enough melatonin, then you lose your sleep. Magnesium tries to restore that. It reduces the cortisol that is formed as a response of low melatonin. So it also reduces cortisol, and it also is related in increasing serotonin levels. So all that put together, it activates the thyroid hormones via phosphorylation, and it also increases serotonin level. It decreases cortisol level, and it regulates the synthesis of melatonin. And there are
So,
many products. I mean, we have our own brand of
yeah.
magnesium called Ultra Magnesium. You can trust Ultra Magnesium. Yeah. And zinc, of course, is, as I said before, it's mainly in thyroid hormone function. It works with all hormones. It is a cofactor in many enzymatic reactions. Over 1,000 enzymatic reactions in the body are controlled or by zinc, or zinc plays a cofactor. It's an antioxidant enzyme. Does it targets and oxidative stress at cellular level?
Okay. Now, this is a person who's trying to ask a question regarding her patient. Patient has Hershey motor and has low level of T3 production, but she does not have dry skin, but it is manifested as acne. Any reasons?
No, as I said, it could be either side of the spectrum. It would be either very dry skin, or it could be very oily skin, because of uncontrollable production of sebum by your sebaceous glands that are located at the hair follicles, end of the shaft of the hair, which is all over, um, everywhere. So if the acne is very severe, then you can try retinol. If the acne is not very severe, then there are antibacterials which work on Mycobacterium acnes, the particular bacteria. But people think that, oh, this acne is because of this condition, and then because of that condition, she's not able to metabolize sugar, so there's too much sugar. That is all nonsense, basically. Acne is not produced by sugar or chocolate or milk or anything like that. You can eat a lot of chocolate, you can drink milk, and you can have sugar if your body can take it. And acne has nothing to do with it. Acne is produced when the sebum production is uncontrollable. Acne is produced when there is bacteria in the hair follicles, and that can be only treated by two ways. One, as I said, if it's not that severe, just some acne, then you can use antibacterial cream as well as systemic antibacterials. And if it is severe, then you should consider use of retinol.
Okay. And the question here reads is vitamin K essential for vitamin D absorption?
No, vitamin K is not essential for vitamin D absorption. Vitamin D is essential for many others to be absorbed. So vitamin D is important for calcium absorption. Vitamin D is important for magnesium absorption, and not to block magnesium by other minerals. But vitamin D's absorption is not dependent on other factors, because the body is meant to have a receptor for every vitamin and mineral, and there is only one vitamin receptor that is common in all the cells of the body. All the trillions and trillions of cells of the body has one common receptor, that is a vitamin D receptor. So vitamin D absorption is not dependent on anything. K vitamin is also an oil soluble vitamin, so it may assist, but it's not, vitamin D depend is not dependent on vitamin K. Also, vitamin K, you have to be very careful. Vitamin K can thicken blood. So if you're on anticoagulants, etc., if your blood is thicker, particularly in elderly, then vitamin K taken for the sake of absorption of vitamin D is not a good choice.
So the next question is, can subclinical hypothyroidism reverse completely with just lifestyle modification and diet without relying on medicines?
It can, according to science. I don't want to be seem to be very preachy here, and I'm not against medical drugs because I'm pharmacist. As my first degree is pharmacy as well, so I believe in pharmaceuticals also, as much as I believe in nutrition. But it can be reversed. The fact is, it can be reversed, but it depends upon how strict you are going to go and how committed you are going to be to that. As I said, everything in this presentation, the 19 slides I presented, can be used as prophylactic as well as treatment. But a treatment will really depend on the commitment. If you can manage your calories, if you can manage what you eat, if you sleep well, if you exercise, and if you manage these minerals and vitamins to be taken as supplement, most importantly, vitamin D, magnesium, zinc, iron, omega-3 fatty acids, if you can take fish oil as well. And in terms of amino acids, I would highly recommend L-tyrosine. If you do all this together, yes, you don't need to rely on medications.
Okay. Now there's a question which is reading as, how can we prevent or diagnose thyroid issue at early conditions, because it is controlling a lot of other hormones.
Prevention, if it is a genetic thing, you can watch it, but otherwise, being specifically careful about thyroid, I don't think that practically we would do it, because there are all organs are equally important. It's not just the thyroid, but people are worried about their liver health. There is so much cases of non-alcoholic fatty liver in India, where alcohol consumption is not high, but liver disease is very high in India, right? So there are so many other things that you consider. But if you have a family history of thyroid, I would say that then you need to check your hormone levels. You need to do those blood tests which show your levels of T3, T4, and you can do that periodically. You don't have to do it all the time, but once a year is okay to see. Prevention is again lifestyle and what supplementation you use. A good lifestyle, if you have predisposition to thyroid problems from your family, you need to be extra careful, need to monitor your hormone levels, but having a good lifestyle anyway with these supplements that we mentioned, and some exercise and enough sleep, controlling your that the dopamine serotonin balance would also help you prevent thyroid complications.
Okay. Now there are two questions. I'm going to combine them. One is how long somebody needs to be on vitamin D supplementation, and the you have explained about the active vitamin D3 from calcitriol, if it's present in the supplement you mentioned, and the source. Can you explain a little more about this?
Yeah, so there are the first question is how long can you stay on vitamin D supplement? So you can stay on a mild dose of vitamin D supplement forever. It's like somebody asking me how long should you exercise? You should always exercise, right? Every day you should spend 15, 20, half an hour for exercise. It's like that. You should take vitamin D every single day. I take vitamin D every single day. And but the dose has to be about 1000 IU a day. That's the maintenance dose. 1000 IU. 1000 or maybe 2000, but not more than that. If you're vitamin D deficient already, then as one of our colleagues asked, can you give 60K a week? But that again broken down into 8, 9 doses, and 7, 7, 8000, 9000 a day is fine, not more than that. So vitamin D, you can keep using it forever, but a maintenance dose of 1000 IU a day once your vitamin D levels are okay. If you're in deficiency state, then little higher, 4000, 5000, or 9000. Um, with regards to the conversion, yeah, it's very important to understand that the body utilizes vitamin D only in the form of cholecalciferol, because it has to be converted from calciferol to calcitriol, which is the absorbed form. And that can be only possible if it is available in cholecalciferol. Now, people talk about all this vegetarianism and vegan sources and all that. It's very hard to get vitamin D from that kind of thing. Vitamin D is vegetarian, but it is not vegan because the vitamin D3 comes from sheep wool, lanolin. Now, some people in some cultures think that anything that coming from animal source they don't want to use because that's vegan. But vitamin D comes from an outside source. It comes from the wool of the sheep. The lanolin is a fat on the outside. So you don't have to sacrifice an animal, kill an animal to get the vitamin D. So actually, it's quite close to being vegan, although it's animal source. It doesn't come from internal part. So that is the most active and good form of vitamin D. So you should look for vitamin D3. Okay. Now there is also vitamin D2, which is ergocalciferol that can come from vegetarian source. It is not bad at all, but the conversion of vitamin D2 and D3 in the body to the active form that will be absorbed will take an extra step if it is not taken in the form of D3. But it is not that it is not going to be absorbed. So it is slightly complicated, but you can still take a completely vegan form of vitamin D as well. That is called vitamin D2. So if you're a vegan and if you don't take anything of animal source, look for a vitamin D2. And if you're okay with animal source, look for vitamin D3. Also, vitamin D3 supplements are much cheaper than vitamin D2, but the absorption is not very different. It will be slightly different.
So, what is the effect or benefit of Shilajit in thyroid?
Not much. Yes, again, a lot is talked about. I'm not an expert in Silajit, but we use that, whenever I hear something new in, trend, I do a complete research of my own and see how is it working and what is the constituents inside. And according to Indian traditional medicine, yes, they have, all sorts of claims they make, but from what we have seen, particularly in thyroid health, I don't see any connection with any of these hormones that we are talking about. Neither T3 nor T4 nor TSH, especially in women, it doesn't have any direct effect. In fact, just so that you believe that you've been working on this and I've done my own research, I'll show you. I have a Shilajit pack here. So, no, it doesn't have a very strong. I've failed to see any pharmacological data that is convincing. There are a lot of papers, but most of the research I've seen is very biased research done by those companies who are selling the product.
Okay. Now, there is again a supplementation by carnitine which is used, but is it a yes or a no for people who are on weight management with thyroid problem?
It's very good. It's carnitine is a very good amino acid, and it is proven because, in fact, carnitine is one of the few amino acids that are related to moving stored fat from fat areas. So the stored fat is held by cells in your adipose tissues. There are fat cells that hold fat, and they only hold for future use, but they never get used because we always constantly feed our bodies. Right? It's a normal human body mechanism that it will hold fat for future use. But if we keep feeding our body carb, which is the primary source of generating energy by burning carbs, you will never use the stored fat. And as I said, don't go on ketogenic diets and all that, but low carb is good. You can control your carbs because, especially Indian diet, we are surrounded by carbs, right? Rice, chapatis, this, that, roti, pulka, puris, everything has carbs. So if you can control carb, then the fat gets utilized. It is very unlikely that people control carb to that extent. We generally take an Indian diet has about 4 to 6 times excess carbs than normal, 4 to 5x than normal carb. So in that case, the stored fat will not get utilized. What carnitine does, it moves the fat out of these stored cells. And there is enough scientific evidence, there enough published data that show that carnitine would do that. And hence carnitine becomes very, very important. The management of fat reduction, both in thyroid dysfunction products patients as well as normal patients.
Okay. Now, how do you build gut health in hypothyroid patients because some of them have excessive bloating? So, for gut health,
So
what
that
recommendation?
the excessive bloating is actually seen in more than some. I mean, I would say hypothyroidism, 75-80% patients will come and complain that about, I have excessive bloating. But the best thing is take a probiotic supplement with a prebiotic to aid the, life expansion of that probiotic gut bacteria. So just taking a probiotic supplement would not be very useful because of the situation of the gut and the gut thyroid axis being dysfunctional. The bacteria will not last long in the intestine if it's not fed with prebiotic. But if you do this, if you take a probiotic supplement, say with 20 billion CFU, healthy bacteria, and if you supplement your diet with fiber, um, if you're struggling to get fiber from fruit and veg, you can start taking a spoon of isabgol, and so that would be very useful to kill that bloating. Also important to remember is that when this kind of thing happens, sometimes dietitians also tell their patients to increase the intake of cruciferous vegetables
Yeah.
so that the bloating, yeah. But in actual fact, cruciferous vegetables, they're very good, but they increase bloating. Yeah, they increase bloating. So instead of cruciferous vegetables, which are generally very good, so generally if somebody says have a lot of cauliflower, cabbage, broccoli, I would say good, it's right. But in hypothyroidism patients or patients with general thyroid dysfunctioning, I think it would be bad because they are rich in goitrogens,
Yeah.
which prevent iodine absorption. Okay, that will in fact cause more disbalance in the T3 and more deactivation, and also not help with the bloating. So I would say that the fiber in this case should come from non-cruciferous form. So give the probiotic, and the prebiotic fiber should come from something like a soluble fiber like a inulin or a psyllium isabgol.
Okay. Now there is one question related to hyperthyroidism. So we have talked about all the nutrients. Can you throw some light for people with hyperthyroidism?
What is the percentage of hyperthyroidism in India? Is it more hyperthyroidism or more hypothyroidism?
More is hypo, but there are cases of hyper also that we are seeing now.
Correct. Yes. So there are some cases, and they
Mm.
are comprehensive. We talked about comprehensive management of thyroid health when we started looking at thing. In my opinion, hyperthyroidism links to more organ health, and the elevated T3, if you don't treat hyperthyroidism, it increases the risk of these long-term diseases. As you can see there now, I showed that slide before as well. It is things like osteoporosis, things like cardiovascular problems. These come with hyperthyroidism. Now, fortunately, India has a low incidence of hyperthyroidism. The elevated T3 levels, they accelerate bone remodeling cycle, so they shorten the bone formation phase and increase the bone decreasing phase. So concurrently, they have low TSH levels, which fail to inhibit the osteoclastic activity, so the bone reabsorption will continue, resulting in higher rate of bone loss. So this generally happens in elderly patients. And in heart complications, this increased T3 levels can elevate a heart rate and elevate increased contractility also. So it can cause things like tachycardia, sorry, not tachycardia, bradycardia, and it can cause arrhythmias in heart. So the best way to look after this is to have high level of calcium, vitamin D, magnesium, which will control that osteoclastic activity and the loss of calcium. So you would not have too much calcium in the blood, but you will have the calcium deposited in where it should be deposited. And in terms of managing your cardiovascular symptoms, which is also a danger with hyperthyroidism, the two things that I would really recommend is managing the four minerals that the heart needs: sodium, calcium, potassium, and magnesium, these four minerals. And other is a high intake of omega-3 fatty acids. So a high intake, I would say about 10 to 15 grams of fish oil a day would be a good intake to manage that. So two things I would say: increase calcium levels and increase omega-3 levels.
Okay, now we're trying to understand the risk of thyroid disease in pregnancy untreated and even in relation to liver disease. What is your comment on that?
So as I said, liver and thyroid will always be connected. Okay, so the if you have a thyroid imbalance, you would have liver imbalance because the gut is controlled by the liver actually, because most of the enzymes are formed by the liver, and any drug you take, any supplement you take, the breakdown will happen because by the liver. So it will be affected, and you have to look after the liver health alongside your thyroid health. So that the best thing to do that is through uh, remove liver toxins and use ingredients, products that will purify the liver. So I don't know if silimarine is available in India. Is silimarine available in India? It's also called milk thistle. It's a
Mhm.
herb.
Yes. Yes.
It is a very good protector of the liver, especially for people with thyroid problems. So a tablet or a capsule, or even they come in powder form of silimarine, taken with saw palmetto, is also a herb that will protect the liver, especially for those thyroid patients. And for pregnancy, thyroidism, again, it's a iodine deficiency that will cause that thyroid problem in deficiency in women, and that is 9 in 10 women have that deficiency. Some at a higher level, some at lower level. So I would just say that from today itself, stop avoiding things that have iodine. So stop avoiding milk, stop taking fat unnecessary, don't go for everything fat free. If you have normal fat in your diet, which should constitute to about 20% of the calories, it's fine. Above, when it goes above 20%, then it's called a high fat diet, but 15 to 20% of fat is very good. So if you regulate your fat intake, if you consume normal milk, if you have normal iodized salt, it should not be a problem, even maintaining and having a healthy pregnancy whilst you have hypothyroidism.
So, Rohit, I am seeing a lot of compliments for you. Very well received lecture today. And the
Thank you.
questions are still there, but I will just take a few more, right? Can
Okay.
we?
Okay. Yes, please. Yeah.
Okay. So here there is a question regarding thyroid issues for PCOD women. Are they more prone to thyroid issues?
They are not more prone to thyroid issues. Both PCOS, PCOD, they're not more prone to, but there is a family history of thyroidism, then they will have PCOS. It's like that. It's a converse relationship. And but it can be very well controlled. In fact, most governments now are recommended 150 micrograms of iodine even when you plan pregnancy, even before you're pregnant. So it has quite become a part of infertility treatment, at giving enough, even enough iodine. So if you start with that 150 micrograms of iodine during pregnancy, it should not be a problem, and PCOS, PCOD can be completely controlled. Also, B vitamins play a big role in that, because they are methyl donors. B vitamins are methyl group donors, so they can actually affect um, these functions at genetic level. A lot of this thyroid dysfunctioning, and hence PCOS, PCOD, comes genetically to women, from passed from one generation to another generation, and hence why some epigenetic modification can help. And these are the best way to cause that DNA methylation. The part of epigenetic modification, changing your DNA itself, can can be achieved by good supplementation of iodine and B vitamins, even when you start to think of becoming pregnant, when you start planning pregnancy.
And here, I think I will close with after this question the relationship between hypothyroidism and insulin resistance. Your
Oh,
comment.
big, yeah, because uh, the the thyroid hormones in themselves are responsible for how and when and how much of insulin is released. So there is a direct relationship between your hormone functioning, and if the T3 levels are affected and they're low levels, it will affect your insulin resistance, and it will cause higher resistance, and the cells will lose insulin sensitivity, and hence why completely zero carb diet is not right as well. But a diet with very high calorific intake is very bad, especially when your T3 levels are very low. It will cause a havoc of insulin. Your body will give a wrong message that there is enough sugar, and now insulin has to be released, and the insulin will be released, and to break down the sugar. As soon as the sugar is taken care of, the body will feel the need of taking in more calories because it will think that it is in calorie deficit. Then you will eat more and more sugary stuff and then more insulin, and the whole vicious cycle just continues. So yes, when the T3 levels are low and hypothyroidism kicks in, it's very, very important that diet is under control, that you control your calories, try and be in calorie deficit along with a healthy workout regime, which I said 30 minutes a day would be good. But a calorie deficit doesn't mean a carbohydrate only deficit. A calorie deficit means if you're consuming 2000 calories, bring it down to 1600 calories, but equal cut on all except protein. Protein can be in a higher level because it functions, it helps with other functions of the body. But that's the best way to control that. That's the best way to control insulin resistance and keep the cells sensitive to insulin, by controlling your calories, be in a slight calorie deficit, and increase your exercise. Along with aerobic exercise, if you can do some resistance exercise, maybe 3 times a week and 5 times aerobic exercise, that would do a lot to control that.
Thank you, Rohit. It was wonderful session and you've patiently answered all the queries. Still, there are a few. I think
Still, there
we
are
can take it. Yeah,
one
yeah, it is
one person is asking carnitine dosage. I think Rohit, you should give it in.
not.
Yeah, carnitine dosage could be anything from 20 mg to 100 mg, and it is basically about what you take the carnitine with. Because if you're taking carnitine alone, it will help, but if you're taking carnitine along with other amino acids, it will help more, and then you need only 20 to 50 mg of carnitine. But there is no upper safe limit that you cannot take a very high dose of carnitine, because anything unabsorbed will be thrown out of the body, but anything absorbed will help in fat metabolism and moving of stored fat. I would recommend take 20 to 50 mg of carnitine every day for long term use, and take it with alongside other amino acids also. If you're particularly looking for building muscle fiber and losing body fat, it's also recommended that take it alongside branch chain amino acids. So there are 3 branch chain amino acids: leucine, isoleucine, and valine. They're very, very important in this whole overall cycle.
Thank you. Thank
Thank you.
you, Zamrud, and thank you, Rohit, and all the participants, because I think the participants are very enthusiastic. They are asking a lot of questions. They are very, very hungry for knowledge, so that's a good thing. And we've had this wonderful series of 7 lectures and talks by you, Rohit. Of course, this is the last of the series, but this is not the end. And we will definitely have many more, because there's a lot of enthusiasm and lot of people who want to know a lot of application nutrition. So that's we look forward to it. I thank the participants, and we look forward to our next event that is coming up. We are having a series on renal nutrition. I will send the flyers very soon, and we will meet very soon. Rohit, maybe in India as well.
Thank you very much. Looking forward to that. It was a
Thank you.
pleasure talking.
Thank
Thank
you,
you.
Thank,
Irene. Thanks,
thank
Rohit.
you.
Bye.
Thank
Thanks.
you.